Hello, I'm Dr. Ann Peary, Assistant Professor of Medicine at the University of North Carolina in Chapel Hill in the Division of Gastroenterology and Hepatology. I am one of the authors on the paper, Burden of Gastrointestinal, Liver, and Pancreatic Diseases in the United States. This paper will appear in the December 2015 issue of Gastroenterology. So most of us are well aware that GI diseases are highly prevalent and costly. These diseases are also a substantial burden to our patients' quality of life. Given this burden of disease, the National Institutes of Health will spend $1.6 billion on GI research and $619 million on liver research this year. So having current numbers to quantify the burden of disease is important in public health research, priority setting, and resource allocation. Because of this, my colleagues and I wanted to create a complete and up-to-date report detailing the current state of GI, liver, and pancreatic morbidity, mortality, and cost in adults in the United States. To achieve this objective, we gathered data from several complementary national databases. First, we tabulated the leading GI symptoms and diagnoses in the United States from the National Ambulatory Medical Care Survey and the National Hospital Ambulatory Medical Care Survey. These national surveys are sponsored by the U.S. Centers for Disease Control and Prevention to provide reliable information about the use of ambulatory care services in the United States. Here in Table 1, you can see the leading GI symptoms prompting an ambulatory visit in 2010. Abdominal pain was responsible for more than 27 million total visits, followed by diarrhea, vomiting, nausea, and bleeding. And here in Table 2 are the leading diagnoses in the ambulatory care setting for GI diseases. Notably, there were more than 7 million visits with the diagnosis of GERD. Hemorrhoids accounted for nearly 4 million visits, more visits than constipation or nausea and vomiting. Next, we compiled the most common and selected emergency department discharge diagnoses from the nationwide emergency department sample. This resource was developed by the Agency for Healthcare Research and Quality and is part of the Healthcare Cost and Utilization Project. This sample includes discharge data for emergency department visits from 950 hospitals located in 30 states and is the largest all-payer database in the United States. Here you can see that GI hemorrhage was a common diagnosis in the emergency department with almost 800,000 visits. Not surprisingly, more than half of these visits resulted in a hospital admission. Notably, there are just as many emergency department visits for constipation as there were for GI hemorrhage. Next, we compiled the most common inpatient discharge diagnoses from the nationwide inpatient sample, another database in the Healthcare Cost and Utilization Project. This database contains a 20% sample of discharges across 44 states. The nationwide inpatient sample is the only national hospital database containing hospital charges for all patients, regardless of payer. Here you can see that GI hemorrhage was the most frequent discharge diagnosis, with more than 500,000 discharges in 2012 at a cost of nearly $5 billion. Now, we also used the nationwide inpatient sample to perform temporal analyses for the number of admissions and associated charges for Clostridium difficile, inflammatory bowel disease, and liver disease between the years 1993 and 2012. Here you can see that hospitalizations for Clostridium difficile infection are continuing to increase. Naturally, charges for inpatient Clostridium difficile are also increasing. Regardless of inflation, the increase in spending are statistically significant. Next, we collected GI and liver cancer statistics from the Surveillance, Epidemiology, and End Results program of the National Cancer Institute. The SEER program collects and publishes cancer statistics from a collection of population-based cancer registries and represents approximately 28% of the United States population. We gathered the most recent version of the SEER estimates available from the SEER Cancer Statistics Review. Here you can see that there are almost 137,000 new cases of colorectal cancer diagnosed each year, and there are more than 1 million people in the United States living with a diagnosis of colorectal cancer. Pancreatic, gastric, and esophageal cancers remain common and lethal malignancies. Finally, we generated a list of the most common causes of death using data from the Centers for Disease Control, wide-ranging online data for epidemiologic research. This is a publicly available database provided by the Centers for Disease Control. Here you can see that the top 3 causes of death remain colorectal cancer, followed by pancreatic, liver, and intrahepatic bile duct cancers. Clostridium difficile continues to be a source of significant mortality. So these are just some of the results from our work. There's certainly more in the paper, notably in the tables, which were just too lengthy to present here. We hope you find this data useful. Please feel free to contact us if you have any questions or would like to discuss. Thank you for watching.